a physician, I have seen numerous patients over the years, and I have advised on countless occasions the need to practice healthy eating and a regular exercise. I'm sure for many of you, your doctor has advised you to eat better and exercise. Most people don't enjoy taking medicines, and if truth be told, they would like to take none, but certainly less. Today, we want to reintroduce to you two of the most powerful medicines for treatment of many of your health conditions. In fact, I take them myself. I have looked many a patient in the eyes over the years and told them honestly that these medicines are just as important, if not more so, than any prescription I could ever write for you. What are these two medicines? Number one is a healthy diet, and number two is regular exercise. These prescriptions are effective not only in helping to prevent common conditions like high blood pressure, diabetes, high cholesterol, and heart disease, but also are effective in treating them. Since many of these conditions are closely related to poor lifestyle habits in the first place, these lifestyle prescriptions actually address the underlying cause and in some cases can even lead to reversal of disease progression.
Good afternoon, everyone. I want to say welcome to the individuals that are just joining us for the first time, and for the people that have been with us in the past, welcome back. Before we start, and actually I'm standing for today's session, I invested in, and I want to use that word. I think it's a great word to think about when it comes to health. I invested in a stand-up desk for the house so that I could do a lot of my work standing up, which I think is fabulous. It makes you feel so much better. You're not sitting down all day, and we're actually going to talk about the effects of sitting. But before we start, I want to congratulate Lifestyle Medicine Institute and Jerry Stocks, who's the president of Lifestyle Medicine Institute, and the entire team for becoming certified, the first program to be certified by the American College of Lifestyle Medicine, the ACLM. That's a tremendous honor that they achieved. And really what we learned in this program is actually why that certification was certainly long overdue. It really signifies that the ACLM, the American College of Lifestyle Medicine, really understands and recognizes how vitally important food is and how important the CHIP program is. And I say this over and over again, as an integral part of the solution to the healthcare crisis that we deal with on a regular basis. So again, congratulations. Today's session, we're going to talk about the optimal lifestyle. What is the optimal lifestyle? It's something that we should all be really striving for. But before we really jump into that, I want you to think about the standard American lifestyle. What is the standard American lifestyle really all about? When you think about it, it has to do with people being more inactive, poorer or less healthy nutrition. The quality of the sleep is not as good. Everybody is so stressed out. I mean, all of these things really create a situation where mental health is a problem. There's more depression and insomnia and anxiety that we have to deal with as part of the standard American lifestyle, if you will. Suboptimal social support, really in the past several months that we're going through this coronavirus pandemic, and even with all the civil unrest now, I think social support is really something that's been on the downslide, and we really know that this is so important. And then the things that I think are also extremely important is passion for living and motivation. What actually motivates you to get out of bed in the morning? So that's a really bleak description when you think about it of the standard American lifestyle. And then we get into the standard American diet, and we know that's a sad diet, as they say. The standard American diet basically has two food types, and we're going to show you some pictures here, and then we'll talk about them. So you can see on the screen here, what's being shown are pictures of the two groups of foods that primarily make up the meal for most Americans, meat and dairy. And I really like to make the distinction as far as meat, because that encompasses red meat, processed lunch meat, fish, and even chicken. Yes, chicken is meat. Chicken is an animal protein and definitely associated with just as many chronic illnesses as all of the other meats that I mentioned previously. So these are the so-called meat products. And then we get into the dairy. Now, I want to just bring up the book, the latest book by Dr. Neil Barnard called The Cheese Trap. And here's a picture of it. Dr. Barnard has done tremendous work over the past 30 to 40 years, talking to people about the health of food, what really happens to people when they eat healthy food or when they don't. So if you have not read The Cheese Trap, I recommend it highly. He really does a great job of explaining why cheese, number one, is so addictive and why it's such an extremely processed food filled with chemicals and with hormones and antibiotics, bacteria, pus, viruses, pesticides. The list just goes on and on. So if you haven't read Dr. Barnard's book already, I would implore you to do so. So that's the book. So now let's get into the optimal American lifestyle. What does the optimal American lifestyle actually look like? So if we think about that, we're eating healthy food every day. We have the ability and we actually get out and exercise on a regular basis, or at least we're physically active. Maybe we're replacing our sit-down desk with a stand-up desk. Quality sleep, setting time. It's really important when you think about this. If you're going to get quality sleep and you're going to get enough quantity of sleep, 7 to 8 hours per night, you really have to set your alarm clock for when to go to sleep and when to get up. Minimizing stress, supportive social environments, education, access to quality care. Access to healthcare is so important. And then I also like to think about mentors that help us stimulate a passion and a motivation for living. So that's really a good description of what an optimal American lifestyle really should be. And this is something that, as a CHIP facilitator, as a healthcare provider, you can talk to your clients and your patients about, so that they really get an idea of what they should be striving for on a regular basis. And what I also like to do is ask, are these things, the way that I just described the optimal American lifestyle, are these things that are involved in your life? Because if you're a healthcare provider, I really think it's important for us to think about, are we being role models for healthy living? Are we showing that we also are striving to live healthier and to do things that we know will lead us down the road away from chronic disease and along that road to greater and greater health? Let's get back to considering healthy food. There's a story about feeding someone a meal. If you feed someone a healthy meal, you feed them for that meal or for that day. But if you teach the individual how to shop and how to prepare healthy food and how to enjoy healthy food, you actually feed that person for a lifetime. So think about the value that you bring as a facilitator or someone that is a member of one of the CHIP programs. What you're actually doing is learning how to do this on a much deeper scale. What's on the slide here now is really a picture of healthier food. When you learn how to prepare such a great meal as shown here, you really feed yourself for a lifetime, and then you really start to influence people around you. When people see that you're getting healthier, they might ask, hey, what is it that you're doing? You look great, you lost weight, you look fit. And you can see there's a couple of slides here that we're showing that just show what healthy food actually looks like. You have grains and beans and unprocessed whole foods. That's really the key. So when you're creating that meal, you're looking at that meal and saying, these are foods that are grown in our environment. They're not processed. I know that they're going to keep me healthy. So I really want to focus on the foundation for healthy living as obviously being food and other things that we'll talk about today. Now, when we start to think about places in the world where there are more healthy people and more centenarians, more people in their hundreds and beyond, there are certain places in the world that are called blue zones. And I'm going to give you a trivia question here. We're going to put up a poll. Where are the blue zones? And you'll see this on the screen. And we're going to take 1 minute to talk about the blue zones, and you can click on your answers. It's a multiple choice question, so click on the places where you think the blue zones are. And as we do that, you can think about, why is it that these places, which are geographically distant, they're not close to one another, how is it that these individuals are in their 80s, 90s, and even beyond 100 years of age? What do they do that makes such a difference? Well, they live the optimal lifestyle. They naturally are born into this world where they eat healthy, they're physically active, they have great social support, they get good sleep, they have learned to minimize their stress. So all of those things really lead into being healthier on a regular basis. So it looks like we're counting down, and we'll see how many people have answered it correctly. So we can see that 89% of the people identified Sardinia, 95% Japan, Okinawa, 79% knew that Costa Rica was another blue zone. 95% of the people knew that Loma Linda was a place, and Icaria, Greece. So congratulations, that's great. We have a well-educated bunch of people on the line. So that's a great trivia question, and maybe you can put that on your blue zone as visiting all those places. So what we're really essentially trying to do in the United States, and let me just step back for a second. At the bottom of your screen, you can put in some questions. I'll get to the questions in a few minutes, so if you want to put those into the chat box. But what we're really trying to accomplish in the United States, and they've been doing this, and obviously they've done it in Loma Linda, California, is to duplicate and to create blue zones. But in order to do this, we have to be given the right education, the right training, and as was mentioned at the beginning of the program, the right prescriptions. So I hope everyone has a physician or a primary care provider, healthcare provider. Does your primary care provider write a food prescription for you? Does the primary care provider or your physician write an exercise prescription? And we'll see next. A prescription pad should be used for things other than writing for medications or writing for procedures or writing for surgeries. The prescription pad should talk about exercise. That should be a written prescription, and hopefully your physician or your healthcare provider is also a role model for healthy living. And there are a number of physicians that I know across the country that do this program called Walk with the Doc. So really, as an action step for you, for everyone that's on the line, if your physician doesn't already know about this and is not involved, talk to them about the CHIP program, about plant-based eating, about doing a Walk with the Doc program, because when I do them, it's amazing how many people will come out and join you. Your own patients and clients see that you do believe in health enough that you're out there walking and exercising and living healthy. So how do we choose food? I think a lot of people choose food based on convenience, on price, on taste, obviously, on habits. But do people really choose food based on health, and even less so on the environmental impact? And that's one area that Dr. Barnard's done a fabulous job of really helping the world to be a healthier place because of his impact on the environment. Also, when we think about it, food choices are made by culture, based on culture. You know, depending on what culture you come from, you may have very different views on what healthy food is. Food choices are made based on emotions, and everybody knows about emotional eating and comfort food, if you will. The last news press article that I wrote last week, it should come out next week, talks about why we just go to food when we need to be comforted, when things are going bad. Why is it that we only focus on food, and what other things can we use as comfort to decrease our stress level? Another important point to think about is when you're having conversations with your clients or with your friends or family even about food, realize that because of the things that I mentioned, culture, emotions, comfort, and such, oftentimes the conversation can get a little defensive. So you have to really couch your conversation in a way that individuals don't get defensive about the conversation, and realize that what you're trying to do is just talk about what your experiences are with healthy food and healthy living, and hopefully translate some of that information to other people. The other thing that's important when you're having that conversation, whether it's with a family friend or with your clients and patients, is understand that everybody has their own readiness level for change. Are you ready to really make a significant change so that you can improve your health? You may be contemplating, you may be in a pre-contemplative phase, you may be ready to take some action steps. So really identifying readiness for change and what's motivating individuals to make changes is extremely important. Next, before we get to the questions, I want to leave about 10 minutes for questions, is to talk about the optimal lifestyle and sitting as the new smoking. We should have some, well actually, why don't we just play this next video from Darren Morton about sitting.
Well, of course, some of you are already exercising regularly, and if that's the case, fantastic, keep it up. But if you need to be spared from the inactivity crisis, let me show you how. You simply apply SOS. The first S is for sit less. It's not uncommon nowadays for people to spend upwards of 14 hours a day sitting, and that's not including sleep time. And researchers are discovering that there are tremendous perils associated with prolonged sitting. In fact, an emerging field of science called inactivity physiology is showing that sitting for prolonged periods causes changes in our body in things like the enzymes that catalyse our bad LDL cholesterol. In a study published in the American Journal of Epidemiology involving over 120,000 adults who were monitored for 14 years, those individuals who sat for extended periods of time in their leisure time, that's outside of work hours, and did not perform regular physical activity, had a greatly increased risk of premature death. The increase was 94% for women and 48% for men. But here is the interesting thing. Even those individuals who did exercise regularly, but then sat for extended periods during the day, still had a significantly increased death rate. And what's more, this increased risk of premature death remained even when the researchers took into account whether the individual smoked, was overweight, had high blood pressure, or was socially disadvantaged. So sit time is now recognised as an independent risk factor.
Okay, so sit time is an independent risk factor. So at this moment, I want everybody that's sitting down to actually stand up, move around a little bit. You can continue to listen to the rest of the broadcast, and we can go through some questions in a little bit. But I want you to also think about the 3 S's: sitting or a sedentary lifestyle, stress, which is tremendously on everybody's mind today, and screen time. Those 3 things really contribute significantly to the poor health of so many people in America. And then I also want you to think about the 2 M's. So we have the 3 S's and we have the 2 M's: mindfulness and motivation. If you're not mindful about your health on a regular basis, and that really should be the #1 priority. Your health should be your #1 priority every day. And motivation to stay healthy. Sometimes it's easier just to stay on the couch, and you really need to motivate yourself to put those sneakers on and go for a walk, or get on your bike and take a bike ride, or just get out in the fresh air. So for the CHIP facilitators on the line, I want you to think of yourself as a health coach, dealing with all of the above challenges that we talked about, but being able to help your patients and your clients to really develop an optimally healthy lifestyle. And to do that, I think it's important to also encourage people when they need motivation to keep a diary and to really look at the details of what they do on a regular basis, looking at what they eat regularly, if they're exercising. So many of my patients will tell me, I'll ask them, do you exercise? And they'll say, well, I'm exercising. Well, I'm trying to exercise. Well, yeah, I'm doing it once a week. So I think the important point is, what you don't measure, you really can't change. And a diary allows you to really look at realistically what you're doing with your life, and realizing that health is the #1 priority, and we really have to take care of our health. Dr. Deal mentioned in one of the other CHIP broadcasts that the CHIP curriculum has been very carefully structured. So what I ask all of you on the line here today on the program, and ask this of your patients and your family and friends. Is your daily plan for healthy living carefully structured? Because if it's not, you need to make some changes. And as a question, what do we know that reverses and prevents and helps to treat high blood pressure, diabetes, overweight, most other chronic illnesses? The answer, very simply, and it was mentioned at the beginning of the program, is whole foods, natural foods, foods that are grown and not processed, in addition to the exercise that was also mentioned. Realizing again that CHIP is not a diet, it's part of the solution. It's a part of the healthcare solution that we need today to really improve healthcare and improve the health of the population. We know that food is important. We know that exercise is important. Darren Morton mentioned that over the last 100 years, exercise levels have decreased 60 to 70%. And when we really think about play, when your parents told you years ago to go out and play, let's put up these pictures and we'll talk about the differences between play then and play now. So this is really interesting. On the left side of the screen, play back then when we were younger had to do with getting outside and, you know, flying a kite or doing a tug of war or just running around like maniacs with your friends. Play now is playing like this with the thumbs, sitting in front of a computer or a screen. Completely different. These are individuals that are just a setup for poor health because they're sedentary the majority of the time. And then they're probably snacking while they're watching television or on the computer, and that really just leads us down the wrong road. So health is really all about transformation. It's a journey. It's not a destination. And I really would like to thank all of you, before we get to the questions, for joining us on this journey with Lifestyle Medicine Institute and with CHIP to really help our population be healthier. So let me look to see if we have any questions. Can you recommend Blue Zone resources to read more about optimal living? Yes, actually, there are 2 Blue Zone books now. Dan Buettner was the original individual that did the research on the Blue Zones, and he actually has 2 books that are out. I probably have at least one of them on the shelf behind me. But really, just paring down the information that's in that book, it really relates to the foundations of healthy living, what we talk about in the CHIP program, what we talk about in lifestyle medicine programs. The foundations for healthy living are what we just talked about. And the reason that people in these Blue Zones live so long is because they naturally do all of these things that were mentioned. There's really 5 or 6 pillars: nutrition, physical activity, sleep, stress, mental health, purposeful living, talking about motivation and a passion and such. So easy references. And if there are other topics that you would like to hear about, the purpose for this program is to obviously give more information about the value of CHIP, but also to be a resource to people that are participating in the program and to individuals that are facilitating the program. Is exercising better for losing weight or diet? Well, if you know the story of Jim Fixx, you will know the answer to that question. Jim Fixx was a marathon runner. In training, on a regular basis, he ran 10 miles every day. And somebody asked him once, why do you run 10 miles a day? His answer was, so that I could eat anything that I want. And unfortunately, Jim, the marathon runner, died of a heart attack while running at 50 years of age. So obviously, the answer is, what's most important to do is make sure that what you put in your body on a regular basis is as healthy as it can be, because you cannot, as I say, you can't run away from a bad diet. So if you're eating a poor diet and you're exercising on a regular basis, it still will catch up to you. If you have to sit for your job, what can you do to improve your health? Obviously, there are so many other things that you can do, but if there is a way that you can do some part of your job standing up, I still encourage people to do that. When I was at the hospital working there, all of the operators, all of the secretaries, so many people that have sedentary jobs, I would say to them, if you can't afford to get a regular stand-up desk, get a milk carton and put your computer and your telephone up on a milk carton so at least you can stand. If there is something that you can do every hour to get up and move around, that's extremely valuable. So you definitely want to put in the activity on a regular basis, and research shows that doing short bursts of exercise is probably just as useful as doing a half an hour or an hour at a time. Again, I want to encourage you to use the show as a resource for yourself personally, in your personal life, in your job. Spread that information around to as many people as you can, and please invite people to join in on the show. Anyone can log on to the Zoom session every Wednesday, 3 o'clock, same time. So invite as many people as you can. Our job really should be to improve the health of ourselves, the people around us, and the world at large. So we're practicing population health. Do the best that you can over the week, and I will plan on seeing you next week. Thank you so much for participating. God bless.